All right, everyone, I think we're going to go ahead and get started. Can everyone hear me, especially in the back? Okay, awesome. I was going to say we're going to start on time because, as you can imagine, in healthcare, being on time is a critical skill, not just a nice skill to have. So let's get started. My name is Maninder Desai, and I'm one of the program advisors here at BCIT. Tonight's agenda is going to be a brief overview on the Diagnostics and Therapeutics programs, and I will be providing that. Following myself, there will be a approximately 5-minute presentation on each of the programs you see listed up here. And then I'll return for a few minutes to talk about program advising. After the formal session in this theater, we're all going to head out these doors to our right, and we're going to head down the hall into Town Square A and B, which is across from the Rick's Coffee Shop. And there you'll have a chance to ask any questions that you may have. There'll also be other faculty members there, students there as well that you can talk to. I'd like to say hello to the online community. My colleague Bhavina Garadia will be responding to any questions you have during the time the session is taking place, so for the next hour approximately. And let's continue. So we're excited to let you know that in approximately 2020, we are going to have a new building on campus. Excited for a couple of reasons, because this building is going to be specific to health sciences. It's going to be called the BCIT Health Sciences Center for Advanced Simulation. It will be one of the largest centers for health simulation training in Canada, and will be unique in its ability to replicate a variety of hospital and clinical settings, laboratory settings. Students will be able to develop their clinical skills as they safely practice realistic scenarios in a controlled environment. We're also excited because we don't get new buildings very often, so we're very excited about this one. BCIT graduates, as you may know, are job ready for a variety of reasons. One of them, as we mentioned, you're getting practical skills on campus, but in these health sciences programs, in addition to being in a classroom, you're going to be in a hospital as a student. This hospital can be in the Lower Mainland, in some cases throughout BC, and in other parts of Canada as well. So you have to be willing to be mobile. In addition to our job readiness, one of the things that makes BCIT programs is unique is that our students study in a cohort model. What that means is that when you're a student, or when you get accepted, you actually get placed into what's called a set. A set is a small group of students. It could be as small as 16, in some cases I believe even smaller, and could be as big as about 24 students. And so that's not very big. So you travel with your set to all of your classes at BCIT. The advantage of the set setting is that you have a very good cohesive group of students to rely on for assistance in classes, outside of classes. So you become really like a family here. The small class sizes also mean that you get the chance to get to know your instructors really well at our school. There's really no way to hide when you're one of 16 or one of 24. And you want to get to know your instructors well at BCIT because these instructors are the ones that have been out in the field. They've experienced what you're going to be experiencing. So they can teach you a lot that can't be learned just out of a textbook. And they're great people to network with as well. We have amazing support for our students. We have, you have, as I mentioned, your peers, your instructors. We have a counseling department on campus. We have a medical services clinic on campus as well. So if you're not feeling well, you can go there and they have different practitioners available to assist you. The programs here are accredited. They're accredited across Canada, or it's a, sorry, I should say a national accreditation, which allows you to work across Canada as well. In some cases, you can work in other parts of the world as well. That's a question you can ask one of the faculty members or one of the program heads or students if you have interest in that. To get into these programs, typically you need strong high school sciences. So that's usually biology 12, physics 11, some cases physics 12. One or two programs may require chemistry 12 as well. In addition to that, English 12 and pre-calculus 12. Now, those are just the minimum requirements. Majority of the students accepted into our health science programs have some additional post-secondary courses. And that can be anywhere from a bachelor's degree completed to maybe 1 to 2 years of additional post-secondary studies. And if you're sort of wondering here, you know, what do I need to get to that point? That's where advising can assist you. So we'll provide you with our contact information later on and how we can assist you to prepare for one of these programs. Gaining volunteer work is, of course, very helpful. It helps you to really figure out if you're interested in healthcare And it helps you to, we're up, sorry, you guys are all, prepare for the mandatory questionnaire you have to fill out. It also helps you to prepare for the multi-mini interview as well. If you can get work experience that's related, that's great. If you can't, gaining work experience working with people in any sort of capacity is very helpful. I'll come back to the multi-mini later on, actually. And then if you're conditionally accepted, there's some other additional documents you may need to submit, but those are relatively easy to obtain. Now, medical diagnostics is a patient-focused field, so that means in addition to using tools and instruments, you have to be willing to deal with patients. Patients of diverse backgrounds, so you have to have good people skills. It's, of course, a very fast-paced and dynamic work environment. You could be in a hospital in some cases. You could also be in clinics, so you don't have to be in a hospital setting if that's not of interest to you in some programs. You have to be willing probably to work a variety of shifts, particularly in the hospital, so that could be a morning shift in some cases or an evening shift. And the representatives will tell you, in respects to their program, the different shift hours that you need to be considering. There's opportunities for continued growth, and you're going to hear about those later on. We have 2 advanced areas of studies that will be, you'll be provided information on as well. And as I was mentioning, the national certification allows for employment across Canada. So we went over some of these things. Proficiency in English is very important. Having strong speaking and listening skills is very important. You need to be able to communicate effectively to your team, and you need to be able to understand others, and particularly patients when they're trying to tell you there's something wrong with them. So having those skills is very important. Being in strong physical strength is important, because sometimes you may have to, you're doing an assessment, a patient is falling, you have to be able to assist them. Of course, mental health is very important, so having a strong emotional intelligence is very important in this area as well. Time and stress management is not only important at BCIT, it's going to be important in your profession. At BCIT, when you're in a program, you're in a set program. You can't pick and choose courses. You can't pick only having 3 courses or no Friday courses. You have to take the program as it is being offered. Strong decision-making, problem-solving skills, initiative, teamwork, interpersonal. These are some of those skills that are important essentially in most professions, but particularly in this field. Computer literacy, a lot of these programs, you're using different programs and softwares to do your or for the diagnostic tools, so that's very important. Strong 3D visualization, manual dexterity as mentioned, and eye and hand coordination. So these are some things to think about. Are these things that you're good at when you try to sort of research online what it means to have these strengths, and try to maybe do some online tests to determine if you are strong in these areas. Most of these programs this evening have 1 intake a year, which tends to be September. The cardiology program has 2 intakes, January and September. But medical radiography, nuclear medicine, radiation therapy, sonography starts in September of each year, and only in September of each year. Electroneurophysiology starts in September, however, every 2 years the intake happens. And then MRI and health leadership have 3 intakes. They have a January, April, and September intake. But remember, those 2 programs are advanced studies. So now I'm going to call on our rep from Cardiac Sciences.
My name is Robin Wolf. I'm a program head and clinical instructor in the Cardiac Sciences Department. In the Cardiac Sciences Department, we offer 5 different program options for you. The first program, and our largest program, is our Cardiology Technology Diploma program. In that program, we teach our students how to perform electrocardiograms, which you might have heard of as being called ECGs. There we go. ECGs, also, if you're from south of the border, EKG. They also do ambulatory cardiac monitoring, as well as teach our students how to perform exercise stress testing. Cardiology technologists work alongside other members of the cardiac team to diagnose and care for patients with heart disease. The diploma program takes approximately 2 to 5 years to complete. I'd say the vast majority of our students do it full time, so they are doing it in 2 to 3 years. It's a blended delivery of the program, so the didactic courses are delivered online, so those can be taken at a distance. And then our cardiology students will come to our cardiology lab here before they go to their first clinical practicum, and they'll practice the skills, hands-on skills. And then we also have 2 different clinical rotations for that program. So our students will go to their clinical practicum placement in anywhere across Canada. So we do take students in from both East Coast and West Coast. In addition to the diploma program, we also have certificate programs in advanced cardiac specialties. And these programs are designed for allied health professionals that already have cardiology experience. So the first program is the Cardiac Rhythm Device Technology program. And this program teaches students to work with patients that have pacemakers, implantable defibrillators, and heart failure devices. The second specialty program is the Cardiovascular Technology program, and this trains students to work in a cath lab. And then the other program, the Electrophysiology Technology program, this trains our students to work in an EP lab. An EP lab is a specialty lab that diagnoses and treats heart rhythm disorders in patients. These programs are typically done part-time, and similar to the cardiology program, they do have an online model, as well as doing a clinical practicum placement. So on average, the students take 1.5 to 2 years to complete that program. And carry on. So cardiology technologists that typically work in the hospital setting, as well as occasionally in private cardiac clinics. The starting wage in BC for a cardiology technologist is approximately $27 an hour. If you have some advanced specialty training, that might be about $28 an hour. If you happen to be a registered nurse interested in this field, you can also take our advanced specialty programs, and because RNs are at a higher pay grade, they would be earning probably $8 to $10 more an hour. Some of our grads go on to work in other areas aside from being in the hospital and in the private clinics. So they go on to work for manufacturing companies of cardiac devices or equipment in clinical or sales positions. And that's pretty much it for what I have to say. So if you have any more questions about our programs here in the Cardiac Sciences Department, I will be in Town Square EMB to answer those questions for you.
Hi, my name is Denise Pilzer. I'm with the Medical Radiography program. So I'm just going to talk to you a little bit about the program itself. So why would you choose medical radiography? And what does a medical radiographer do? So we take x-rays or produce images using specialized equipment that produce x-rays, and we produce images of body parts or extremities. We take chest x-rays and abdomens, and so all body systems, and those images are sent to the radiologist, so a specialized physician, to read and report and produce a diagnosis. Is it a safe profession? Absolutely. The equipment itself produces minimal radiation doses. As a technologist and in our program, we teach you about radiation safety. So how do you protect your patient? How do you keep yourself safe? How do you protect the other healthcare workers that you are working with and the public at large? A variety of experiences. So in medical radiography, taking x-rays, we actually go all over the hospital. We start off by taking general x-rays in the department, so if a patient can come to us, they come to us, and we do the x-rays there. We also go to the operating room, so we are sometimes involved in some of the cardiac cases where they are inserting a pacemaker. So we have a portable fluoroscopy unit that we take into the OR, and so we're in there with surgeons doing those cases. We also do orthopedic cases, so if somebody has fallen and broken a bone and they can't just cast it, we do go in and actually are part of the team that when the surgeon puts in plates and screws. So if you don't like blood, it's not a good place to be. We also go to the OR, so we're part of to the ER, the emergency room. We're part of the trauma team. So if a trauma comes in, we have portable equipment that we take in with us. And when we are called upon, we step in and take X-rays of whatever areas the doctor is asking. We go to the ward, so again, if a patient is quite ill and can't come down to the department, we'll take our equipment and go to the wards to take X-rays there. We do fluoroscopy, so that's dynamic X-rays, and so we can give patients a lovely drink to drink, and it's called barium. It's a white chalky substance. A patient can drink it, and then we are in the room with the radiologist and watch the patient swallow, so we do swallowing studies with the radiologist. We also do CT scans, so that again is a specialized piece of equipment that will actually take images of slices through a body, and we can look at the anatomy in like a three-dimensional projection. The equipment also can reformat the information gathered from these scans to produce 3D rendered images, so you can take like an organ system and actually rotate it and take a look at it from all sides. It's a really fast-paced, unique challenge, so every patient that we encounter has a different history, has a different background, so we're always interacting with our patients. We're always moving fast, trying to keep up with the patients waiting in the waiting room and making sure that everybody is put through in a timely fashion. The profession is a blend of technical and patient care skills, so our main focus is our patient. That's why we're there. So part of the program is to teach you about patient interactions and conditions of patients, but also because of the equipment we use, it can be quite technical, so you should have a technical ability as well. An overview of the program. The program is a diploma program. It's 24 continuous months, and so there is no long breaks. You'll have like a week or two in between terms. The first summer term that you come to, as much as you'd like to have it off, is an online summer term, so you do have some flexibility where you can travel as long as you have stable internet access and can get a proctor for your exams. You can travel around a little. The pathway of the program is to have alternating terms between academic and clinical. So the first term is academic in September, and then we get you right out to clinical in January for 20 weeks. It's the longest clinical term. And then 2 more clinical terms that, again, alternate between the academic and the clinical. We offer a variety of educational methodologies. So every course that you'll encounter will be a little bit different. We have some courses that are strictly large lecture room formats with 80 students and an instructor lecturing. We also have online courses, and we have applied lab courses. And so again, you know, you're applying what you're learning in the lectures in the applied lab. We don't allow you to x-ray your fellow student, but we do have you practicing the positioning that we're teaching you. And then certified instructors are in those rooms with you, giving you guidance as you're moving through those positions. Clinical sites throughout the Lower Mainland and in the interior and in the Kootenays. So we have a total of 18 clinical sites. They are, and they're all in a hospital, vary between a large trauma center to smaller community-styled hospitals or more specialized hospitals like BC Children's. So job opportunities. Most of our students, once they graduate, will be able to work in the hospitals in casual positions. Within a health authority, you can work at multiple sites. So you'll get build seniority that way and get experience that way. Again, it was mentioned before that there is a national certification body for this program, so you can work anywhere in Canada. providing extra opportunities. We are a 24/7 profession, so if there's an emergency room that's open 24 hours a day, then there's usually an X-ray tech that works the same type of hours, so days, weekends, afternoons, and midnights. And laddering opportunities, so plenty of laddering opportunities and specialized certificates. Once you've graduated from the program, there's a mammography certification you can take to specialize in breast imaging, interventional radiography, so where we're actually working closely with the nursing team and the radiologists in interventional suites. And CT certification, also through the certifying body, MRI. So MRI is one of the programs that you'll hear about later in this presentation. And there's also opportunities for laddering into degrees. So there's one at BCIT, which is the Bachelor of Health Sciences degree, and one at Thompson River University as well. Hourly wages start at $28, over $28 an hour, and usually up to $35 or $38 an hour, depending on the position, the shift that you're working, and like we also do some work in the morgue. So when you watch those CSI shows, it's usually an X-ray tech, a certified X-ray tech, that'll be in those situations taking those X-rays. So you get a little bit more pay for going down to those situations. So that's about all I have to say. If you want to come over and ask any questions, we're in Town Square A and B. And I'd like to now introduce you to Joe Cartesi from the the nuclear medicine program.
Thank you. So my name is Joe Cortese. I'm the Radiation Safety Officer for BCIT, and I'm an instructor in the nuclear medicine program. A lot of people don't know what nuclear medicine actually is. What nuclear medicine is, it's taking a small, safe amount of a radioactive substance and injecting that into a patient. That's one part of the profession. Another part is getting that radioactive substance ready. And some parts of the radioactive substance, instead of taking an image and taking a picture with them, they actually use them to administer to a patient to treat. So if you had an overactive thyroid or maybe a thyroid cancer, you could get somebody to drink a radioactive drink, and that radiation would get accumulated in the thyroid and actually treat it. And they would use it that way. Where X-ray takes radiation and passes it through your patient and look at what gets through that patient, what nuclear medicine does is put that radiation inside, and instead of seeing where things are, it looks at what's happening inside the body. So that radiation goes to where there's higher metabolic activity. If, let's say, you were looking at the heart muscle and you wanted to see if somebody had a heart attack, if there wasn't blood getting to a certain part of that heart muscle, you could inject a radioactive tracer that goes to heart muscle and look at the parts of the heart that are getting blood and the parts that aren't. And you could make a diagnosis that way. So instead of looking at what's there, it's more looking at what's happening inside that person. A lot of people are concerned about the radiation. The radiation is a small amount and it's a safe amount. It's safe for the patient and it's safe for the technologists that are working in the field as well. There's a large amount of patient interaction in this profession. So you're giving injections, you're quite close, you're intimately interacting with your patients. So you want to make sure that you're comfortable with that if this is a selection for you. The other part is there's a lot of work with needles. If you're squeamish about working with needles, this may not be the best choice for you. So you have to be comfortable with injecting people and using sharp objects and trying not to poke yourself in the process as well. Preparing the injection is a part of the job. Patient explanations are big. So again, as we said before, that strength in communication, getting your point across, answering questions, making sure people are comfortable. How the program works is we take in 16 people every September. From September to May, you're in a classroom. So you're in a classroom setting or a laboratory setting face-to-face. In the first summer, so from June to August, you go out into a hospital rotation. So you're visiting a hospital, you're doing clinical practice, you're observing what happens in the hospital setting, and you're participating in that. In the second year, from September to May, we take 2-week rotations. So 2 weeks you're in the classroom, and then the next 2 weeks you're out in the hospital again. We rotate back and forth. And then for the second summer, you're back in a hospital. In those hospital clinical rotations, you'll have a chance to visit 4 separate sites. So you'll see the BC Children's Hospital, you'll get to visit the BC Cancer Agency, Pet Center, and CT rotations. You can be required to travel from Vancouver Island and all the local hospitals. Most major hospitals have nuclear medicine departments. It's 24 months continuous program, so you are in school for 2 years. You finish in September. There aren't a significant number of breaks. It's a heavy course load, but very, very successful students. The job opportunities, so once you're out of here, you can get between $28 and $35 an hour. Basically, you're working in hospitals. One difference with nuclear medicine is that the job is primarily 9 to 5, Monday to Friday. So there aren't a ton of nighttime or weekend shifts. There are some on-call shifts, but they're rare. The majority is Monday to Friday. Laddering opportunities. We've had lots of people go into sales jobs, so sales for the companies that produce the machines that take these pictures, sales for the sales for the companies that produce the radiopharmaceuticals that get injected. And if you have any other questions, I'm going to have a couple more instructors and some students in the booth just over in Town Square B, and I'd like to pass it along to Lorraine in radiation therapy.
Okay. Hello. I was hoping to show the image, but we'll carry on. So radiation therapy is a degree program at BCIT. It is a Bachelor of Science. Radiation therapists, you may not be fully familiar with what a radiation therapist does, but we're responsible for treating cancer patients using ionizing radiation. So our responsibilities include imaging patients in order to plan their treatments, and we work closely with radiation oncologists, the doctors, and medical physicists as well. We use safe practice when administering the radiation therapy treatments. We interpret patient setup instructions and provide the daily radiation treatments that are needed to either cure the cancer, and in most cases it is for cure, and in some cases it's for palliation, which is relieving symptoms as a result of their cancer. The program, as mentioned, is a Bachelor of Science, so the entrance requirement is for the applicant to have 1 year university, which includes math, physics, and English, and other credits for a total of 30. You come into our program for 33 months. It is a full-time program, and like the other programs I've mentioned, there's minimal time off. There's some weeks in the summer, time at Christmas, but essentially between the academic terms and clinical terms, you're a full-time student. We do have a small class size, so typically our intake is around 12 students. Now, I wouldn't let that throw you off. If you are deeply interested in radiation therapy and you meet the entrance requirements, I would encourage you to apply. We go through a multi-mini interview process, and we're not looking for what you know about radiation therapy, but rather we're looking for good communication skills, problem solving, critical thinking, and so forth. Our curriculum focuses on the academic theory of what you need to know, but we also include 49 weeks total clinical practice at 4 of the major cancer centers in the province. That's the Island, Surrey, Abbotsford, and Vancouver. And we also use a good degree of simulation or lab practice so that you can master some of the skills before you go out into clinical. The work environment. So probably a lot of you, as soon as I mentioned cancer patients, you probably thought, ooh, depressing. It really isn't. You would be amazed, I think, if you went into a cancer therapy department to see the positivity and resilience that the patients have. And rather than be depressing, it is an uplifting, challenging, but very rewarding career choice. We work in teams, so typically you work in teams of 3 to 5 radiation therapists per treatment unit. It is a busy environment. We treat perhaps 30 to 35 patients a day. So it moves very quickly, you're on your feet. But again, it's very engaging and very challenging. And we build relationships with our patients. So we see our patients daily. We work Monday to Friday. We don't work weekends and stats. But we see them daily for their treatments over the course of perhaps 4 to 7 weeks. So there's a real bond that is created between the radiation therapist and the patient. We're also the first people they talk to about any reactions they're having from the treatment. We can advise them on how to take care of their skin, nutritional needs, and so forth. The job opportunities, because of the specialization for radiation therapy, employment is through, in this province, it's through the BC Cancer Agency. So currently there's 6 provincial cancer centers, so the 4 that I mentioned previously, but also Prince George and Kelowna, that's the other. Once you are a graduate of the program and you pass the national certification exam, you are then qualified to work anywhere in Canada, and that qualification also is recognized internationally. So we've had graduates work in England, in Australia, Hong Kong as well. It gives an opportunity to travel and work and experience the world while you make pretty decent money. Full-time wages in this province start at approximately $32 an hour. And I think that is all I was going to present to you. We do have a booth as well in Town Square A and B, so please come and see us if you have further questions. And I will pass this on to Ken Markin from Sonography. Ken, yeah.
Thanks, sir. Hi, everybody. My name's Ken Markin, and I'm one of the instructors in the Diagnostic Medical Sonography program. For most of you, you can see the slide, and it's of a woman that's actually doing an obstetrical scan. And primarily, most people, that's what they think of ultrasound. They actually think of us scanning the developing fetus inside the mom's belly. But you know what? Ultrasound is way more than that. And we use high-frequency sound waves in order to examine all kinds of different soft tissue inside your body. So from, obviously, the developing fetus, but we can also look at, the pelvic organs in a female, looking at the uterus and ovaries and urinary bladder, right up to also looking at the liver, the gallbladder, kidneys. We can also look at superficial structures, such as the scrotum, the thyroid. We can even look at your rotator cuff muscles. And we can also look at the cardiovascular system as well, including the veins in your legs. We can look at your carotid arteries and even your heart. And with ultrasound, it's very dynamic. So we can actually look at the cardiac motion, the motion of the heart muscle, as well as the valves themselves. So a very interesting and dynamic sort of area. Now, with ultrasound, our job really is that we're looking at the patient and trying to answer the clinical question. So we take images in real time in order to answer that. And we work as a team, but we're also one-on-one with the patient in order to try to achieve answer the clinical question. Patients need to have, or I should say sonographers need to have strong communication skills, because we have to relay that information to the radiologist that we work with. And things with the program itself, just to let you know, we actually have 3 options. We, here at BCIT, we have sonographers, they're dual trained, which means that they actually get training to do both general sonography as well as cardiac ultrasound. And that program itself is 27 months in length. But we also have 2 shorter programs. One that just strictly covers the general option, which is 22 months in length, and also a cardiac option, which is also 22 months in length. And so prospective candidates, they can choose their options. They can choose and then stream into their options typically after their first year. We're a cohort-based program in that we take in 32 students. So you're all together taking a common first year. It's you take a common first year, and then everybody does a common first clinical. And then in their second year, they actually stream into their various options. Either the dual stream, where they actually do their third level, plus they do their complete clinical, which is around 46 weeks in total. And then they also do, the cardiac or the general options, where they have clinical as well, which is about 26 weeks. So it's a very exciting profession. Salary ranges are between $30 to $37 an hour. And of course, you can work in a number of different sort of areas, both in hospitals and clinics. And certainly, if you're dual trained, you can work in the general lab as well as in the cardiac lab. And of course, if you work in the general field, there is an option to work in private practice as well too. So if I did mention earlier, salary ranges between $30 to $37 an hour. So the outlook for sonographers is very strong, and so really high employment opportunities. And so certainly, if you'd like, stop by our booth in Town Square A and B, and we can let you know more information. So let me introduce Christy from Electroneurophysiology.
Hi, everyone. My name is Christy McIntosh. I'm the program head and also a clinical instructor in electroneurophysiology. I also wish that you could see my slide, because my first slide has all these really interesting electrodes sitting on the head. So it can, especially little children, find this very interesting. So I'll tell you a little bit about my program. We're not a common program. We're not found in most hospitals, but there are quite a few that do have us in the Lower Mainland. Electroneurophysiology technologists perform several tests. The big one, electroencephalography, which is also known as EEG. This test is used to look at the electrical activity in the brain, and the way we do this is by putting little tiny electrodes on the scalp. They don't do anything, they just listen. Another test that our students learn to do is something called electromyography. And this test actually looks at muscle and nerve disorders. It's also known as EMG. And this can range from anything from carpal tunnel syndrome to more serious disorders like ALS. But that test is actually much less commonly performed. We also learn to do something called evoke potentials. And this is looking at the integrity of both the peripheral and the central nervous system, the continuity from one to the other. And that's a test that looks at primarily multiple sclerosis. Finally, we also go into to do intraoperative monitoring. So again, if you're squeamish about blood, this would not be the place for you. And that's often done for epilepsy surgeries, brain tumors, sometimes something called endarterectomies, where they're listening to the brain but performing surgeries on the carotid arteries, and also certain back surgeries, actually, when they want to make sure that the integrity of the spinal cord is not compromised during the surgery. Finally, we also learn a little bit about polysomnography, so if somebody wants to go into that at a later time, they're somewhat familiar with this. It's a much less common type of test, and it's sleep studies. So the results of these tests are used to evaluate the integrity of both the central and the peripheral nervous systems in conditions, as I said, such as epilepsy, brain tumors, head injuries, nerve injuries, muscle disorders, multiple sclerosis, and sleep disorder. So a little bit about our program. We are a diploma program. We are 2 years full-time. We take in 10 students from BC and occasionally students from other provinces if one of their hospitals would like to sponsor them. We're only one of 3 students in Canada, or sorry, pardon me, one of 3 schools in Canada. And this is important because it really ensures job opportunities once you finish our program. So we have 3 clinical experiences for hands-on skills. So at the end of the first year in June, our students go out for their first clinical practicum. It lasts 4 weeks. In the 3rd semester, so the 2nd year, our students go out for 2 weeks in October. And then in the 4th semester, which is the final semester of the 2-year program, the students are out continuously from January till May. So the clinical experiences can occur at hospitals across Canada. We do ask that half of your clinical experiences are somewhere other than the Lower Mainland. So like many other programs, the hourly wages generally range from $30 to $37 an hour. It depends often how much call you do and what province you actually choose to work in. I like telling people that with our program, I'd say 100% of our students have jobs before they graduate. And I do remember even about, I think 4 years ago actually, 80% of our students had jobs lined up in January, about 5 months before they graduated. So they're very highly sought after just due to being one of 3 schools. Our students actually find employment mainly in hospitals. There are a few clinics, but not too many. Like many other of the allied health fields, we're primarily 9 to 5. Some of the bigger tertiary hospitals also do have an on-call schedule as well, and this can be quite beneficial. It's for some people who are looking to make some extra money. Also, the on-call schedule tends to be weekends only and not a 24-hour call schedule. So there is a strong employment outlook. We're well established. This program has been going on at BCIT for many years. And I'm happy to take any of your questions in the booth. Okay. And I would like to introduce Domenico.
Hello everyone, I hope you can hear me okay. My voice doesn't carry that well, so if you can't hear me, let me know. My name is Domenico Celli. I'm the program head for the MRI program and the degree program. A lot of people don't know what MRI is. It's magnetic resonance imaging. It's kind of a mysterious thing because people get put in this big tube with lots of noises and then all of a sudden this really beautiful high quality images come out. And nobody really understands how that's possible. But what happens is at the MRI, we put them in these big magnets and we bombard them with radio frequency waves. And then the patient gives us radio frequency waves back, and this is what we listen for to produce the images. The interesting thing about MRI compared to the other modalities is that we're not measuring how much radiation is going through you or sound waves, but we're actually measuring energy that's coming out of your body. And the other interesting thing about MRI is that it uses no radiation, no ionizing radiation, so it's perfectly safe. Patients can have 1,000 MRI scans and it's not harmful at all, and of course it's not harmful to the technologists that work in the MRI department. And the amazing thing about MRI is that we can image just about any, I think I'm supposed to be doing this thing here. Okay, so the amazing thing about MRI is that we can image any part of the body. We can do everything from a torn ligament in your thumb to brain tumors, heart disease, vessels, blood vessel problems. There's nothing, no condition that you could have that wouldn't benefit from an MRI scan. Yeah, I mean, we even image unborn babies in their mother, for instance. So we image anything and everything. And so it's a very, very interesting technology, and it's constantly expanding. New things, new ways of using it are being found every day. And it's probably one of the fastest growing technologies in the medical imaging field. Our program here is a post-diploma program, which means that you have to be a technologist already before you can do our program. So you have to be an ultrasound technologist or radiographer or nuclear medicine, radiation therapy, but you have to have one of those first. And if you successfully complete one of those programs, then you can do our MRI program. So it's considered an advanced certificate post-technology program. The other interesting thing about our program is that it's totally online. So you don't have to come to BCIT at all, which means that if you, say, become an X-ray technologist and you want to do MRI, you can keep working as an X-ray technologist and still do our program. The only stipulation is that you have to allow 4 months for clinical experience in one of the hospitals, which we arrange for you. Now the other really, which usually takes about 2 years to complete, I should say. But the other really interesting about our program is that it ladders to a degree program. So once you've done the MRI program, you can continue on and get your Bachelor of Science in Medical Imaging through us. But you have to do the MRI program to continue on to the bachelor's program. So the way you do this is up to you. You can enroll right away into the bachelor's program and just complete the whole thing, including the MRI part. Or you can do the MRI program first, work as an MRI technologist, and come back and do the bachelor's program. And again, it's all online, so all the courses for the bachelor program can be done at your own pace at home or wherever you have internet access, and you can continue to work and complete the program. So you have 5 years to complete the bachelor's program. So the MRI program requires certain skills of the technologist. The most important skill, I think, is people skill, because the MRI environment is really, really threatening. It's very stressful for people because you can imagine you put them into this long tube, which makes them, sometimes people describe it like being in a coffin, and you bombard them with these really loud noises, which can be kind of scary. We give all our patients earplugs because it's so loud in the machine. So your ability to be able to calm that patient down and relax the patient, because they're already coming in thinking, oh, I've got some horrible life-threatening disease. They're already stressed out. Now you're going to put them in some stressful situation. So to get their cooperation, which is really important, you have to know how to talk to people, how to relax them, how to make them feel comfortable in a stressful environment. So that is, I think, by far the most important skill. But other than that, you have to really be comfortable with computers and with technology, because you're going to spend a whole day programming the computer to produce all these amazing images for the physicians. So now the MRI program is really, as I say, it's a growing field with many expanding job opportunities. So the vast majority of our students get jobs right away, right after they graduate, either in the hospitals or in the clinics. And It usually doesn't take long before they have full-time employment, because, as I say, the two things are happening. One, there's more scanners coming, and the other is that the scanners that are there, they're expanding the hours as much as they possibly can, because there's huge long waiting lists for MRI. Because MRI is so flexible and it can image just about any disease process, there's a huge demand for it. So they are doing their best to expand and meet that demand, so that means more jobs. So the wages can range from about $33 to $38 an hour in the hospitals. In the clinics, they can be more. They can be $40, $44 an hour. And the reason they're usually more in the clinic is because they don't provide the same quality of benefits that the hospital provides. So the hospital has lower wages but better benefits. The clinics has better wages but less benefits. So anyway, I hope you come and visit me at the booth there, and we can discuss this more if you have any questions. And the only thing I can say to close things off is that we guarantee you that you will develop a magnetic personality. Okay, so I call on Shan from Health Management to come next.
Okay, thank you, Dr. Nico. And I'd like to thank as well all of you for being here today. It's an evening during the week. The weather may not be so great outside, and so thanks for your time for being here. So my name is Shan Shatoglu. I'm the program head for the healthcare management area in our School of Health Sciences. I also have some other roles at BCIT. I'm jointly appointed into the School of Computing and Academic Sciences to raise awareness around data and use of data. As well, within our school, I'm the chair of our school research committee, so that means I work with many of my colleagues to identify and start some research projects and activities. So I'm going to speak about the healthcare management program, but as I go through, you may hear some other areas that relate to these other topics that I have to speak about. Okay, so I have a question for you. Could you please raise your hand if at some point in your life you were responsible for a group of other people who are something like yourself, maybe like in a club, or in a church, or in a community setting, in school, sports. Please just raise your hand if you are responsible for somebody else or a group of people. Okay. And then how many of you found that to be kind of an enjoyable, meaningful experience? Just raise your hand. Okay, and how many didn't? Raise your hand. Okay, there's some didn't. Hopefully the ones who enjoyed the experience are also the parents who are in the room, because oftentimes you're organizing and leading a group of people in that respect. Okay, I have another question for you. How many of you came here and you already knew which program you were interested in? Please raise your hand. Oh, that's interesting. That's about half. Okay, and who had a second program in mind? Okay, so that's about a quarter. Well, that's really interesting, because what we've heard from our program heads so far are programs that are about various clinical areas in diagnostics and therapeutics. Now, health leadership is a different program because it's not clinical. It kind of takes a career in a different direction, and I'm going to speak about that. So if you found that you do like to work with other people and organize people, and you find yourself potentially interested in being a part of making change in the system and helping other people in healthcare to advance and improve, then the healthcare leadership program at BCIT might be something for you. And if you do find yourself in that position after you graduate from your first program, work for a while and have some experience, then you're invited to come back to BCIT and continue your studies in this program or other programs that we have in our institution. So the Health Leadership Program is a part-time advanced certificate. It's offered online to working health professionals. So you do need to have health experience, work experience to get into the program. It's highly collaborative. So I was just looking at one of our lists of students, the roster, and just going through all the different professions that are in our program as students. And I can just maybe share some of these with you. Nurse practitioner, medicine, pharmacy, x-ray, MRI, sonography, radiation therapy, respiratory therapy, physiotherapy, clinical counseling, health informatics, an entrepreneur, biomedical engineering, healthcare managers, social work, finance. So the whole mix of people from different areas. As well, they're also in different provinces. So most are in BC, but there are students in other provinces and some in other countries who are part of the program. So the program is highly interprofessional and it's also collaborative. So students get to work together in teams, studying online while they're in the midst of work and life and family, sometimes maybe caring for parents or maybe having a family of one's own. So, and in addition, the program in its last course is actually a project that you do in your own workplace. And in this project, you try to solve some sort of problem that's really important to the organization. And guess what? Someone from the organization is interested in your project, and they're something like your customer. And in addition, BCIT works alongside with you to address some of these problems. Okay, so our students, as they are in the program, sometimes they advance in their careers or sometimes they advance after the career. The way advancement works is that people become leaders of their clinical area. They may be team leaders, project directors. They could be kind of like a clinical leader. And as well, people tend to advance outside of their workplace, so they become part of their professional association. They may take on volunteer roles in that respect. They may work on committees that are in between health authorities or in between organizations. So when students go through our program, there's kind of like a broadening of perspective, and it kind of opens a world for more development as a learner. If you think about it, in your first credential, it could be 2 to 4 years long. You might have some previous studies after that or before that. But then if you look at the lifespan for your career, there's a chunk of time, like 30 years or more in your career, and most likely you should do some additional studies at some point in that stage. So the program like this could be for you. So the average hourly wage for our graduates, this is a little bit skewed because everybody is working already and they're taking more studies. The average hourly wage is around $44 an hour, but it depends on a lot. It depends on location, the person's previous profession that they came from, which they added more advanced learning to. So there's a lot of variation in this, but you might look at 44 as kind of a benchmark for that. Yeah, and people can be part of a bargaining unit, so in a health professional kind of bargaining unit, or be excluded, be part of the management kind of category, and some may be even working for themselves. Okay, so that's all I have to say about our program. I do have very detailed slides that are not shown here, but I could email it to you if you want to see more. As well, I'll be, along with others, part of the groups outside. Please come over and speak to me. I'd be happy to hear from you, and if you have questions, I'd be happy to address them at that time. So thank you.
Great, so thank you to all the program representatives for the informative information. I'm just going to finish off by giving you some information on program advising. So you've got tons of information on the program. Most of you may have questions about entrance requirements, which I covered briefly, and you may not meet a requirement, so how you can meet a requirement, or if you're wondering if a course you have from college or university fulfills a requirement, those are just some of the questions we can field in program advising and assist you with. If you need to write a challenge exam, in some cases those options are available as well. Those of you that have studied in post-secondary and may have already completed a bachelor's degree may be interested in finding out if any of your courses transfer. So we have some information for transfer credit as well. However, there is limited transfer credit. If you go to the Every program webpage on the far right has a courses section. So if you click on that, it lists all the courses in your program. And you'll notice the courses in our program are very specific. You don't take a lot of general courses at BCIT. So that is why it's difficult to get credit for previous studies. However, if there is a course that's very much a match with what you've done before, you can apply for transfer credit and it will be assessed, but you do that after you've been accepted into BCIT, not prior. So those are some of the main areas we can assist you with. I want to just quickly go over the application process for health sciences. So most of the health science programs, I believe all of them, have a deadline date. You can apply before the application deadline date, and we do advise you to apply early to find out if you are missing something. Sometimes or you think you have everything, but you're surprised after the fact. So apply early because it gives you time to meet the requirement that you may be missing. If you are missing a requirement, your application is not incomplete. You have 60 days or until the deadline date. It's whichever comes first to fulfill that requirement. You're not going to find out if you're shortlisted, though, until after the application deadline date. So please be patient. Wait till after the application deadline date. The timelines vary depending on the program. Sometimes within a couple of weeks you'll find out if you're shortlisted, and sometimes it may take a little bit longer than that. After you've been shortlisted for most of our health science programs, there's a multiple mini interview. And what is a multiple mini interview? It's many different ways you can find out what one is, but one is just to type it into your browser and there'll be a lot of information that will come up. But basically it's an interview process where there'll be different stations and you'll be asked different questions from different representatives. So lots of information online to help you prepare for that. After you've completed the interview process, the decisions are made. The decisions are usually made either based on the interview or based on a combination of your academics, work experience, or volunteer experience, and your interview score. If you have any questions for us, we don't have our contact information up here, but if you go to the BCIT homepage, right from the homepage, there's a Connect to an Advisor button. You can click on that and contact us, and it gives you all the different options. We're available via email. We're available by telephone and in person as well. In addition to advising, there are lots of other services available at BCIT. Some of these services you can access before becoming a student. So some of you may be interested in finding out if you can get a student loan for your program. So we have a financial aid and awards department, and you can contact them, you can set up an appointment to meet with them prior to becoming a student, and they can discuss that with you, how much money you may be eligible for if you become a student. We also have a disability resource center. If some of you may need assistance while you're a student, you can contact them to find out what kinds of accommodations they may be able to provide you. And then once you're a student, to help you succeed and keep balance in your life, there's many different organizations here. We have peer tutoring available. As I was mentioning earlier, we have a counseling department, medical services. We have a great student association. They're here for you, the student. They're great advocates, and they provide lots of fun programs, but lots of advocacy programs as well. Online, from our homepage, you can also access additional information. So there's no way you can't be prepared and not know if this is the best program for you, because there's many opportunities for you to do research now online, whether it's on our webpage or just out there in the World Wide Web. Ask questions of our program representatives. We have student blogs, so if you're wondering what it's like to be a student at BCIT, these students do an excellent job in writing about their experiences while they're here. I just read a really interesting one last week. It was by a sonography student who was describing the size of our organs to fruit. And so I found that very informative because I was pretty ignorant to sort of the sizes of different. So our heart is the size of a dragon fruit. I always thought it was a lot bigger, but it's smaller than I expected it to be. We have a YouTube channel. There's lots of different videos, and we have Twitter, Facebook, Flickr, so there's a lot of different places you can access information. So as mentioned, we're not going to take any questions here today. We're all going to head out down to Town Square A and B, and please come there and ask questions, and we'll be happy to meet with you. Thank you for your time. And yes, if any of you, we will email the PowerPoint out to everyone. We can email the PowerPoint.